Hi, a very good evening to all of you. Today, we are going to discuss this particular case note, and this about a patient named RAQUEL Jackson. Now, that the writer is a community health nurse who is doing home visit for Miss Jackson. And the letter has been written to the physician of the emergency department for an urgent assessment and management of Miss Jackson. And the letter is to be addressed to the emergency department, Delmont Private Hospital, North Terrace, Adelaide. So this letter is written by a community health nurse to the emergency department physician. And the purpose is an urgent assessment. The it is an emergency situation, so you need to refer to the emergency department physician. So let us go and see what are the conditions there. So if I look at the case note, the picture is very clear, and we don't have a lot of information which is confusing here. The first data is the name itself, RAQUEL Jackson, 62 years. Okay, she's over 60 and she lives alone. And her hobbies, listening to music and reading books, it's totally relevant to an emergency doctor. Husband died due to colon cancer. I don't think that it's necessary. Mother has Hashimoto disease. No. Her mother. No, I don't think that is not needed here to address to the emergency department. If the condition is relevant, then you can do that. I don't think that the condition is something which is relevant here, because the diagnosis which we have here is the latest diagnosis, that is on 11th October 2020. The diagnosis here is hypoglycemia, the final diagnosis due to drug interaction. And this is the thing here. We don't need to mention those things, Hashimoto disease or colon cancer. These things are not relevant here. The doctor lives locally. You can include if it is needed. We have to say something about the doctor. We'll tell why the reason is there. Now, when we go ahead with the medical history of Miss Jackson, she has been diagnosed with type 2 diabetes mellitus since 2008 and is on regular metformin 200 mg. And this patient is also taking brufen, PRN, when for rheumatoid arthritis, because no, she has at present, she has well-controlled rheumatoid arthritis. So the first medical history, the diabetes mellitus, is very important. It has to be reported in the letter. The second thing is an optional data, but you know that as far as we have dealt with drug interaction, we have to say all the drugs which the patient is taking to the emergency department physician. Now, right now he's on metformin. So we have certain medicine names here: cimetidine, methotrexate, brufen. So right now, what is the patient on? So she is taking metformin as per the information we have got. Whenever necessary, she's taking brufen too. Yes, of course. Now we can say that she underwent a laparoscopic cholecystectomy and she had infection and was on antibiotic methotrexate. So the dosage is over and this medicine is not at all important here. So this is important. She underwent a cholecystectomy. That's okay. But for the infection which happened post-operatively, we have treated successfully as far as we have cured the problem, the disease. We don't need to mention that particular thing in the letter. Now let us move ahead. We have why you are taking care of the patient. So the patient got discharged from the hospital and advised home visit by community health nurse. Due to her daughter is going to a trip for 5 weeks, she is out of trip for 5 weeks. She is the only daughter and she lives locally. She's 42 years. She's the responsible person to take care uh, of Miss Jackson after her discharge. But you know that this girl is moving for her a trip, a short trip. She won't be available. So advice, home visit advice was there for a community health nurse. Now, that's the reason why you are writing the letter, because she is not in the hospital right now. She's at her home. You do regular visits or occasional visit. I don't know what type of visit you are making. So you do visit uh, on specific visit, you note these things. And this is the last visit that you have made. That's on 11th, I think. So yes, 11th of October, 2020, you have found something. So the first visit, you don't have any problem. The second visit also, she didn't have any problem. You can say 9th, and she had problem with the heartburn, which lasted less than an hour in the sternum area. And she contacted her GP. And this was diagnosed as a heartburn. And the GP has switched the medicine from metformin to cimetidine. This is a very crucial thing. This is a turning point here in this letter. So the doctor, the GP, a personal GP, has changed the drug from metformin to cimetidine. This is what you can see as the turning point. After 2 days, the patient, when I visited the patient, she was looking very tired, weak, confused, and still on metformin. You know that the medicine was switched to cimetidine, but she is still on metformin. Now, this is what you have to say. Now, further assessment. So she had BP, increased BP, that's 145/95 mm of Hg. HbA1c is lower, that 4%. Blood glucose level was 3.1. So it is below the level, hypoglycemia due to drug interactions. That's diagnosis here. So when we look into the letter, let us see, let's write today's date. That's today is 11/10/2020. Yes, it is written. The emergency department physician, emergency department, Delman Private Hospital, Northwest. Oh, these things are there. Dear doctor, as far as this is a doctor, you can say, dear doctor. Reference Miss RAQUEL Jackson, that's 62-year-old lady. I'm writing this letter to refer Ms. RAQUEL Jackson, who requires your assessment and management on an emergency basis. So you need your assessment, your management for Ms. Jackson. and this is on emergency basis. What happened to her? She has been diagnosed with hypoglycemia secondary to drug interaction. So hypoglycemia is the reality, and it happens secondary to drug interaction. Now we have completed the purpose in two brief sentences. It's very simple. It gives an idea what exactly, for what purpose you are writing this letter. It's clear. Now, as far as you are writing to the emergency department on an emergency for an emergency care, so you need to say the most recent history. Usually, as far as the system, the condition is diabetes mellitus. You usually what we do is that we write uh, when it happened, when diabetes mellitus was diagnosed, and the progress of this diabetes mellitus. This is what usually what we write. See, for example, even if you are referring to a care of diabetic food management, we just start from the beginning. So what do you say, she or she had diabetes this year, and then the progress, it goes on. This is a style of writing. But as far as this is an emergency situation, what we did is that we have presented today first. What is the present situation? The present situation today, this is the most recent visit we have made to Miss Jackson's home, and during this visit she appeared very weak and confused. That's what we have seen. We reported it objectively how she appeared weak, she appeared tired, she appeared confused. Now, on inquiry, she was found still taking metformin, which was switched to cimetidine by her general practitioner 2 days ago, as she complained of heartburn. It's a quite big sentence, but I have to say this particular sentence just to say, just to relate it to the previous sentence. It's secondary to drug interactions. Okay, so what happened? Why, how this problem is there related to drug interaction? This is what we have to say in this particular sentence. So why Miss Jackson's appeared weak and confused? So we made an inquiry. On inquiry, she was found still taking metformin, which was switched to cimetidine by her general practitioner 2 days ago. So on 9th of September, she was switched to cimetidine. Why? As she complained of heartburn. So because she complained of heartburn, the doctor switched, the general practitioner switched the medicine to cimetidine from metformin. But she was found still she was taking metformin. And this was the shocking thing that I found. There's something serious. So we made assessment. Okay, so she might be taking cimetidine as well as metformin, because she has not stopped. So this may be the reason why the blood glucose level might have gone. So we have to see whether, so we have to say, where is the tangible results? We cannot say the patient's condition by seeing her appearance. So we need to go with investigations. The investigations were done, and the results are there. Her blood glucose level was recorded as 3.1, and her HbA1c as 4, very clearly written. Now, so the immediate matter is clear. The most recent history is very clear. She appeared weak and confused. We inquired, we got some information, something serious has happened. She has not stopped metformin, which was prescribed, which was switched to cimetidine by her general practitioner 2 days ago. She's still continuing metformin. This was the thing that we found out. And now when we looked into the investigation reports, we found something abnormal, and what we have abnormal, we have written it. And now I just want the present situation. So she has a BP of 144, 5 bar 95 of Hg. So do we need to write that? Because it's an abnormal vital sign. So it's better to write that thing too. Further assessment, her blood glucose was recorded at 3.1 mmol per liter. So her HbA1c 4% and her blood pressure as 145 bar 95 of Hg. Okay, so I did complete the investigation and I have set further assessment. So this is the situation. The patient is in this condition. The patient has high blood pressure. The patient's blood sugar level has gone down. This is the condition. Now, the general information. So background information. What is the background information? Is she a widow? Yes, she's a widow. She lives alone and had a laparoscopic cholecystectomy on 16 September 2020. She had an operation. This is not the most recent history, but a recent history which comes in the descending order. So what was the latest, the next latest medical condition? It was a cholecystectomy on 16 September. Now it is a month ago. So since her discharge on after 3 days of the surgery, since her discharge on 19 September, Miss Jackson has been visited at her home from our service, as her only daughter is out for a 5-day trip, 5-week trip. So we have no daughter. Her only daughter is out for a trip for 5 weeks. So she has been visited from our side since the discharge on 19 September. This is what you can see in the second sentence, the background information. Now, the most crucial thing here is the history of diabetes mellitus. She has had diabetes since 2008. No, I can say she has had diabetes mellitus since 2008 and is on metformin 200 mg regularly. Now, buprofen is also taken for rheumatoid arthritis, which is well controlled. Now, absolutely, somebody will be asking that whether this data can be included in this particular letter, because it is not at all dealing with the present condition. But you know that the emergency physician should know any harmful other types of drugs are being taken by the patient. So that's why this information is given only to focus the medicine. So that's why we have given the medicine name in the beginning, that is Brufen. Okay, now towards the last, what you have to do, if you could, it would be appreciated if you could evaluate Miss Jackson's condition at the emergency department and provide her the best possible treatment as early as possible. So this is what the letter is. So we have presented the most recent history and the background information in a very systematic order. So you can change the order based on the relevance. If you have a relevant order, so organizing capacity, you can order in a different way. So this organization is good as far as we are dealing with the emergency department. We have dealt with the emergency situation in the first paragraph, and then background information, background medical history and requirements later. Thank you.